So let's go ahead and get started. First of all, hi everyone and welcome. Thank you so much for being here. I'm Amber from Zencare, and we're really glad you've joined us for today's webinar, Understanding Eating Disorders, How to Recognize the Signs, Get Help, Support, and Recovery. At Zencare, part of our mission is to make high-quality mental health education more accessible. Eating disorders are often misunderstood, under-recognized, and more common than people realize. Conversations like this matter. A brief agenda. Today, we will talk about why eating disorders are more prevalent than we think, how pop culture and media can contribute to disordered eating patterns, how to recognize the signs, and what to do if you're concerned about someone you care about. We'll also cover when and how to get help, followed by some time for questions and answers. Before we begin, a quick disclaimer. This webinar is educational in nature and is not intended to diagnose. While Melanie and Lily are eating disorder specialists, they are not your therapists and cannot diagnose you or someone you love without going through proper clinical channels. We will be discussing sensitive topics related to eating disorders, eating behaviors, and the spectrum of severity. If at any point this feels triggering or overwhelming, please feel free to step away now or at any time during the presentation. And before we dive in, we do want to take a mini poll here. You will see a poll questionnaire pop up on your screen momentarily. Please feel free to answer it. It's completely anonymous, but this allows our presenters to kind of understand who is in the room with us. Okay, give this another few seconds for people to answer. Awesome. I will end the poll and thank you so much for providing that feedback. It looks like most of y'all are here in regards to someone else. So thank you so much for showing that concern and providing this feedback. Now that we've done that, I am honored to introduce our speakers. Lily Thrope is the founder of Thrope Therapy and specializes in eating disorder treatment. And then Melanie Rogers is the founder and CEO of Balance Eating Disorder Treatment Center. We're so grateful to have both of them here today. And with that, I will pass it over to Lily and Melanie to talk a little bit more about themselves.
Thank you so much, Amber, for that awesome introduction. And I'm so grateful to be here. So thank you all for taking your time on a Tuesday to be here. I am the founder of Thrope Therapy, a small private practice in New York City. We have an office in Manhattan and also do some virtual work as well. I'm a licensed clinical social worker and certified intuitive eating counselor. Eating disorders are such an important part of my practice because it's something that I have experienced as a client. Being someone who was looking for a therapist who specialized in eating disorders was really hard when I was growing up. And I'm so grateful that there's so many more providers who are working with this population, but also I know that it can be really tricky to find someone who has the clinical experience and sometimes the lived experience that makes it feel really safe to start the eating disorder work, which can be really scary. So I'm excited you're all here to learn more about how to get started and what to look out for. And I've been a part of the Zencare platform for 2 years. I feature my whole group practice on that platform. So I'm really grateful to Zencare for giving me this opportunity to speak and present with Melanie, who's such a great awesome co-presenter, and she can introduce herself next.
Thanks so much, Lily, and thanks Allegra and Amber and Zencare for hosting us today. My name is Melanie Rogers, and I am a certified eating disorder specialist. I'm actually a registered dietitian by training, so Lily and I are hoping to provide a kind of a complementary awareness today through Lily's lens as a therapist, my lens as a registered dietitian, and hence that medical aspect. So I have been running my own outpatient eating disorder clinic called Balance now for 17 years. We are an individually owned outpatient eating disorder center right here in New York City, right here in Manhattan, just off Fifth Avenue and 21st Street. We provide 3 levels of care, the most intensive being a PHP level of care, which is about 30 hours a week. And that's the level of care that clients might join us if they're really struggling, but it's the level just before you might go to a residential facility, which is 24/7. We also have a step down from that, which is an IOP, and we also do individual one-on-one nutrition and therapy services as well. I've been working in the field for about 25 years now and have the very, very good fortune to be on some of the boards and support some of our wonderful associations here in the industry. And it's really a thrill to be here. And I'd like to also announce that Balance went in network with several insurance companies in the last year, including United Healthcare, Cigna, Oscar, and soon to be Aetna. So hope that certainly helps with accessibility, which I know is very important to all of us in the field. Without further ado then, shall we go to our next slide? So eating disorders, many of us honestly don't get training in eating disorders, which may be a shock to some of you, or maybe it actually confirms what you've already discovered. The reason for that is for the longest time, eating disorders were thought to be very rare, less than 1% of the population. We now know that that is a gross underestimate, and in fact, up to 9% of the US population will develop an eating disorder in their lifetime. So when you think about the US population of what, 300 and let's say 30 mil, let's say 300 mil just for easy math, that's about 30 million Americans in their lifetime will develop an eating disorder. That is a lot of people. 15% of women will suffer with an eating disorder throughout their lifetime. So it is very much disproportionately a female-oriented illness, though we're seeing a high uptake in the male population. But unfortunately, very few, only 27% will receive treatment. And this is something that I know is near and dear to my heart and to Lily's. And one of the reasons why we like to go out and do these kind of events for other professionals and for the general population, because the more people that we can help to identify that they may be struggling and help them step into treatment, the better the prognosis. And so we certainly hope that we can increase that 27% and get more people the help they need. So why are some of the reasons that people don't seek support? Shame and stigma is certainly a big one. A lot of our clients come in thinking that they did this themselves because they may have gone on a diet or wanted to lose weight, for example. There's also a belief that they're not sick enough, and this is something we see very, very frequently. I think that there's a stereotype of what someone who struggles with an eating disorder looks like, a very, very kind of skeletal looking figure, but in fact, that's not the norm. And most people, you wouldn't know by looking at them that they had an eating disorder, yet there's a lot going on internally that makes them medically and psychologically compromised. Fear of judgment or loss of control. Going into treatment means having to stop using some of those behaviors, which can feel very much like giving up control. Misconceptions about what eating disorders look like, as I just mentioned, lack of clarity about how to get help. And ambivalence is a very big part of an eating disorder, and therefore many clients may not want that help because it means that they may need to gain weight or change their food behaviors, change their exercise behaviors, and that feels too frightening and overwhelming. We'll go to our next slide.
Yeah, so thank you so much, Melanie, for covering that. And also, we wanted to just mention that if anyone has any questions or comments, the chat is not open, but you can use the Q&A section. It's on the bottom panel. So if you have any questions throughout the presentation, we are going to do a Q&A at the end. And any of the questions we don't get to, we're going to send a follow-up email with our thoughts on that. So we will try to incorporate whatever we can, but please feel free to share in the chat if anything, is coming up for you that you need clarification on. We definitely want to hear from you. So going off of what Mulaney said, it is so challenging for a lot of people to reach out for help. And we think a lot about, why are so many people struggling with eating disorders? And I think there's a lot of pieces that lead people to struggle with eating disorders. And Mulaney mentioned a few, like dieting. Dieting can be one of the first indicators that you're developing an eating disorder and can actually be one of the biggest risk factors to people developing an eating disorder is if they've ever dieted in the past. So this, to me, one of the major ones that we've seen an uptick in over the past, 10, 15, maybe even 20 years is pop culture and media. It's always been there. There's always been this unrealistic body ideal in TV, in movies, in all the media that we consume, even like advertisements on the subway or on any of these Hulu, HBO Max. I don't know if anyone's been watching shows and just seeing so many weight loss ads. There's always been this emphasis on weight being connected to like being in a higher weight or a larger body being connected to lower health outcomes. And I think what we've seen is that's not actually true. And there are so many people who are in larger bodies who are struggling with eating disorders, and those are the people who get missed the most. So this, I think, our current social media platforms that we have now really prioritize these unrealistic beauty standards. They show these bodies that are edited, often filtered, and genetically underrepresentative of what real bodies look like. So I think we're constantly being bombarded with this media that makes it seem like there's only one way to exist in a body, and especially that in order to achieve health, your body has to look a certain way. So I think when we're consuming all of those messages from diet culture, from social media, from TV, from movies, from advertisements, we get taught that certain bodies do equal success, happiness, worth. And even though those standards are unattainable for most and also will lead to poor health outcomes if you pursue those types of bodies, we still associate health with being in a thinner body. So I think one of the things to note as we're going through today is just recognizing that health actually doesn't have a size. There isn't a clear example of this is the size that someone needs to be healthy. And it's such a more individualized thing. So I think social media has made a huge impact on people's relationships to their bodies.
Absolutely. And, to that point, diet culture is everywhere. Diet culture shows up as, Lily was saying, we're seeing it through advertising, we're seeing it through media, constant focus on weight loss. And now with the whole advent of GLP-1 RAs, Ozempic, Wegovy, Zepbound, Mounjaro, we are absolutely bombarded, whereby I think people are almost feeling a sense of shame if they don't actually go on a GLP-1. And we've also heard that MDs are not only encouraging clients to use a GLP-1, but kind of almost pushing it on them, particularly if they are in a higher weight body. We see also diet culture showing up as labeling of food, such as good foods, bad foods, healthy foods, clean foods. In our industry, we try to remove moral judgment of food. I mean, we all know that Doritos has less nutritional bang for the buck than, a salad. However, I would like to make the argument as an RD that my Doritos, in my case, because they're a favorite food of mine, are just as valuable to me from a mental and emotional perspective as my salad or my vegetables and fruit, etc. So in that regard, we really try and remove that moral judgment for food and talk about the enjoyment of food. We praise as a society, we certainly praise restriction, we praise control, We praise discipline. And again, when people are exhibiting forms of discipline and control within moderation, I think we can all say that's reasonable. It's when it gets excessive, it gets preoccupying, and it becomes unhealthy that we're really, concerned about that. And when you put those kind of behaviors toward weight and food choices, that's when things can get into a place of disordered eating or even eating disorder. We hear a lot with diet culture jokes about skipping meals, or I haven't eaten yet today and it's 3 o'clock in the afternoon, and things of that nature, which make me wonder, how on earth are you functioning? And the idea about earning food, that I only allow myself to eat after I've done X amount of exercise or burnt X enough number of calories. And the reality is that our bodies function optimally when we feed them with good, consistent meals throughout the day. And when I say good, consistent meals, I'm not speaking about the judgment of those meals, but not just a snack and not just a piece of fruit. We're talking about really nourishing and respecting what the body's biological needs are. And wellness trends that do disguise restriction as health. There is a common practice that we have recognized called orthorexia. You may have heard about it on social media, where this whole wellness trend towards uber clean eating and uber healthy eating has gotten to a point where people are incredibly unhealthy as a result of trying to pursue this almost perfection with clean eating. So as a result of diet culture showing up in many areas and more, it can certainly normalize disordered eating. And there's a word for that. Actually, it's called normalized discontent, where people think it's just normal to be unhappy with your body and your weight, and constantly thinking about your body, your weight, your shape, your dress size, etc. It also makes harmful behaviors harder to recognize because we're normalizing them, and it increases shame around eating and our bodies. And we'll go to the next slide.
Yeah, so just adding on to everything that Mulaney shared, I think she shared some important things on the last slide. Social media, again, what I brought up earlier, and this constant comparison. I feel like the comparison culture is another version of diet culture, and especially orthorexia. Seeing people post what I eat in a day. I don't know if you guys have been seeing that type of content. It's been rampant all over social media, and it can be really harmful because, like Mulaney said, what we know is that each person benefits from eating consistently throughout the day, but that might actually look different for each person because we're all individuals. And I think when we take social media to say, hey, here's what I eat, and you should eat this too, it's taking out the piece of how do you feel about eating that? How do Doritos feel for you? How does it feel to honor your culture by eating foods that, you grew up eating, so many aspects of eating that can't be boiled down into a black and white slide on social media that says this is what you should eat. And one of my biggest cues for, unhealthy patterns on social media is looking for that word should. The word should has within it a sense of guilt. There's this sense of, oh, I should do that because I'm bad if I'm not doing that thing. And if you see that word or you see people saying what you should do, I kind of want you to run away from that because a lot of these people on social media are not actually registered dietitians who have an understanding of you individually and your needs as a human being, which might change from day to day. It might change from week to week and year to year. So I think one of the reasons that this content is so popular is that people are looking externally for a rule or something to tell them how to feed themselves because there's so much misinformation out there. So I totally understand wanting to see these videos, feeling like these videos are helping you, but actually what's happening is they're causing more mistrust with your own body, your own gut, your own hunger signal. So these videos like this can be really harmful in developing your own trust and relationship with your body. Even recovery content on social media can be really triggering. And I saw a great post by one of my friends who's a registered dietitian that said, when you're posting these before and after photos, to show like honoring Eating Disorder Awareness Week, it's actually really harmful because a lot of people will look at the before photo and see an idealized body that they want to have and might be aiming at that. So I think even the media representation of someone who has recovered can be triggering to a person who's really suffering in silence and doesn't recognize that they're looking at those images and idealizing a really unhealthy version of someone's body. So that's something to keep an eye on. Social media isn't all bad. And I want to be really cautious to make this black and white statement of, get off of social media, don't use it at all. There's something actually really beautiful about social media that connects people to communities that they wouldn't have had access to. For example, seeing people who are in larger bodies, seeing people who are living their lives fully, seeing people who have recovered and are representing what life can look like in a recovered body and how happy they can be. That feels super important. But the constant exposure and increased pressure, especially for young people, but for anyone to just constantly be performing and showing and seeing all of these different bodies, I think just increases our mistrust for ourselves and what we know is best for ourselves.
Well said, Lily. So, and our next section here is, how eating disorders are misrepresented, and media does often portray eating disorders as rare or extreme, and we spoke about that with the underestimation of less than 1% of the population struggling with eating disorders, but now we know it's up to about 9, even 10% of the population. We also know from social media we've seen some of those very extreme examples both in films, documentaries, and certainly on social media. And for the longest time, historically, eating disorders were thought to only affect young, thin, white women and girls, really. And so, for the longest time, doctors and society at large, or healthcare professionals, it didn't even occur to them to screen anyone else. But now we know that no one is protected from an eating disorder. They cross all age groups, all socioeconomic groups, all races and cultures, and are global. And we hear this a lot too, Lily. We've heard that eating disorders are a choice, that someone, can choose to start eating again, for example, if they've not been eating, or they can just stop overeating or stop over-exercising. And we also hear, especially for our younger people who are maybe in their teen years, that it's just a phase and they'll get over it. None of those are true. Eating disorders are not a choice. When someone develops an eating disorder, there is actually a genetic predisposition that sets them up to develop that eating disorder. And once there's actually a number of genes involved in this whole sequence, but once that sequence of genes are switched on, so to speak, then they are not easily switched off. You have to go through a whole recovery process. So they're actually a lot more serious than one might consider, thinking about that genetic predisposition. And certainly, as I mentioned, it's not a phase. We do know also that the only way to recover from an eating disorder is with extra support. It is very, very, very difficult, if not impossible, to recover on your own. And hence we see such low rates of people going through recovery as we saw on our first slide. So what this leads to then is that people don't recognize their own struggles. And we hear this, I'm not sick enough. Oh, that's not me. I don't have an eating disorder. I'm just being very healthy. And actually, I'm saying this with kind of a somewhat smile on my face as I think about so many of us in the field have had our own lived experience with an eating disorder, and many of us remember saying those very words. Oh, I'm just being very, very careful with my food and my exercise, etc. And only as we learned more did we discover that we were actually in a pretty serious place and needed help. Fortunately, I will say, and one takeaway I hope you all do have from today is that full recovery is absolutely possible with good care. And so, but recognizing that you may need help is the first step there. What we also have through these portrayals is that loved ones may minimize concerns as well. And we also therefore see delays in seeking help. What we do know is that the sooner you get help, the better the outcomes, meaning that you're able to get to a place of recovery faster and sooner. The longer one delays, the harder it is to undo those ingrained patterns in our brain. And it can take a lot longer to go through the recovery process, though not impossible. So, eating disorders, in summary, they really don't have one look, and you don't have to fit a stereotype to deserve help. The real key question there is it starting to take up a lot of your time? Are you becoming preoccupied around your weight and what you're eating and exercise habits and body image distress? And if it's starting to take up a lot of bandwidth, then we know that it's a really good time to reach out for help. And we'll go to our next slide.
Yeah, and I just wanted to add on to something Mulaney said. Like, eating disorders are very complex, multifaceted, nuanced things. And I do think the way that it's been portrayed is this one way or this very simplified version of it. And I think what we're seeing more and more at treatment centers and in the outpatient level is that there's trauma, there's complexity, there's other mental health issues that are contributing to why the eating disorder developed in the first place. And I think eating disorders are just so much more complex than they get credit for. I did see a question in the chat. Someone asked, "How is an eating disorder defined?" And maybe we missed a introductory slide and we didn't. This is a very overview informational session, but I can't really answer that question concisely. We will definitely send a follow-up email. There are many different diagnoses within the eating disorder umbrella, and each one has different diagnostic criteria. So I'm not sure if you're asking what is the diagnostic criteria for a certain eating disorder, which we can certainly send you. But I think what we're capturing in this training, hopefully, is that eating disorders don't necessarily need to fit the definition. Your struggles with eating or your body image do not need to fit a DSM diagnosis in order to be relevant and valuable to work on and to get help with. I think often people, again, think they're not sick enough or, oh, it's not bothering me that much. It can be impacting you a lot, even if you don't recognize it. So, I'm not exactly sure which part of that you were asking, but we will definitely try to follow up with that and feel free to clarify in the Q&A if you needed more clarification on that. So continuing on, pop culture and media and how they contribute. Why does this make seeking help harder? I think Mulaney covered some of this, but eating disorder behaviors are very normalized, which makes it hard to see what is distressing about this. I know that so many people get the comment of, you're so disciplined, you're so good. Again, these good, bad labels. To me, when I hear discipline, I always think of self-abandonment, right? The idea that you cannot listen to your own true needs, which are nourishing your body in order to pursue something that's outside of you. Maybe it's a look that you want to pursue. Maybe it's avoiding feelings. It's this sort of self-abandonment of your needs. So I think that label of discipline is actually really hurtful and cues me in that someone might actually be self-abandoning. And if you feel like you are constantly self-abandoning, that might be a sign that the eating is more of a problematic behavior in your life than you realized. People do blame themselves instead of the culture. They say, I'm the one who's wrong. If a diet culture is all around, that means everyone's doing a good job at it, and I'm the failure because I can't follow these external rules. Diet culture profits off of you disliking and hating yourself and believing that your experience of distress is not real. Shame obviously keeps people silent. We know that with all mental health conditions that happens. And I think a really important point is that eating disorders are sometimes prescribed to people in larger bodies. So even though we see some doctors realizing and recognizing that promoting intentional weight loss can lead to an eating disorder and harm, we still see doctors bringing up intentional weight loss as an option for managing medical conditions that actually could be managed by managing stress, by looking at your hormones, looking at your blood work, what's going on with you, and not emphasizing and focusing on intentional weight loss as the only way to change those things. So, in a culture that promotes body control and comparison, struggling with food or body image is not a personal failure. It is something that is happening to you and it's real. And we want you to know that you can get support with that.
Right. So, how do we recognize some of the signs of an eating disorder? And this may actually help with the question that we had there. So, and again, this is a list of some common signs and symptoms. You may not necessarily have all of them. You may have some if you are struggling. So, some physical signs that we do see: fatigue, dizziness, fainting. That's when we get very, very concerned, obviously. Digestive issues, meaning that we often see constipation. We see reflux, for example, acid reflux and a delay in emptying of the stomach. Feeling cold, often particularly hands and feet, and noticeable weight changes up and down can be some of the signs. As far as emotions and behavioral signs, as Lily said, eating disorders are very, very complex, and all of our clients come to us with a medical piece and also an emotional piece. So anxiety and depression are very common as a piece of this. So we do see a second point here, anxiety or guilt around eating. We also see this obsessionality that I was mentioning earlier, which is the preoccupation with food, weight, or exercise. Skipping meals or rigid food rules, that discipline that Lily was mentioning, or eating in secret or avoiding meals. A situation might be a friend who always, you invite them out for dinner and they always come after dinner to join just for coffee and say, oh, I've already had dinner, or you notice that they actually don't participate in meals very often. So those kinds of very subtle signals. Social and life impact signs: avoiding food-centered foods, which are events, which I just mentioned, withdrawal from relationships. This really impacts relationships, difficulty concentrating, and mood changes. We'll go to our next slide.
Yeah, so again, how are we recognizing the signs of an eating disorder? Mulaney just went through the kind of clinical way that we might look and see, is there something going on here? And I think back to the nuance that we were bringing up, not all eating disorders have a look, and also not all eating disorders are going to fit the slide we just looked at before, which had these very neat and tidy, concise um, bullet points of what an eating disorder looks like. What we've seen again and again is that all of these eating disorders are presenting so uniquely and so differently for each person that they go underdiagnosed for a lot of different reasons. But one of the reasons that they go underdiagnosed is that our bodies are wired for survival and they're really, really good at masking things. So when you go to your doctor and you get your labs taken and you know you haven't been treating your body well by either restricting or over exercising or another eating disorder symptom that you're having, nothing might show up in your lab work. And this contributes to that feeling of, I'm not sick enough. Even when things aren't showing up in your lab work, when we don't have that physical, tangible proof, but we know that this is causing so much distress, things that you would have to report. You're reporting that there's distress in your relationships, in your ability to focus, in your ability to feel connected to your life. Those are just as valuable to me as the, again, DSM criteria for having an eating disorder. So, again, if there's something you walk away with, it's that if you at all think that food or body image is related to anything you're struggling with, I hope that you can bring that up to your providers, whether it's a therapist, a trusted doctor, a dietitian. There are so many resources out there, including Balance, which is a great resource if you think you might be struggling. There's such a great process of being able to be evaluated for what level of care is the right fit for you. And there's resources out there to help you figure that out. We can go to the next slide, I think.
Great. So common eating disorder signs, and as Lily has mentioned several times, really emphasizing that they may differ person to person. And so if this resonates personally, you're also not alone though. So some internal signs, constant thoughts about food, weight, or your body, and that takes up a lot of bandwidth. Feeling out of control around eating. So maybe when you start to eat, you find yourself unable to stop when you want to. Shame, guilt, or fear after eating. Maybe you felt that you ate more than you wanted to. It felt out of control. And now you're overwhelmed with feelings of disgust and not sure what to do. The feeling of not sick enough to deserve help, we've touched upon that. And then self-worth being tied to your food intake or a body shape and size. We are so much more than what we look like. Behavioral patterns then, restricting or skipping meals, binge eating, which is when you're eating a lot of food, a large volume of food, and you feel out of control. And compensating behaviors such as vomiting, laxative use, fasting, excessive exercise, diuretics, avoiding eating with others. And we'll go to our next slide.
Yeah, so continuing on this kind of common ED signs, and I know I keep saying this and I'm going to keep saying it, even if you don't have these common eating disorder signs, there could still be something going on. And I think one of the things we're not focusing primarily on today is body image, but it's important to note that even if you aren't struggling with actually the food intake or using, any compensatory behaviors, but you are preoccupied with what your body looks like, worrying about how your body is presenting, worrying about your body changing. That's another eating disorder sign to keep an eye on is not only the actual eating behaviors, but the preoccupation in your head. Something that, we don't have maybe enough time to go into today is there's restriction, which is restricting your food, restricting, your ability to eat as much as your body really wants to. There's also mental restriction, which is believing you can't eat those things. Even if you end up eating them, you're going through the stressful, what I call mental gymnastics in your head of trying to figure out, if I eat this, can I eat this? And if I eat that, do I have to exercise in this way? If you're spending a lot of time in your head thinking about these compensatory behaviors, that's also a sign that there's something going on that deserves extra support and extra awareness. So, as Mulaney said earlier, reaching out early can really prevent things from getting worse, and full recovery is possible. And what we have seen is the longer that someone suffers with an eating disorder, the longer it takes to recover. And that's a really painful process to go through, is knowing like I've finally decided to get this support and this help, and it's actually going to take a long time. These aren't simple things to solve, and there isn't, per se a medication that you can take that can really help. It's this slow unlearning and relearning and trusting yourself and rewiring your brain to really take good care of yourself. So what can you do if you notice any of those common signs that we were talking about? you can talk to someone you trust. And that might be a therapist, it might be a friend or a family member. My caveat with this one is that some people are going to congratulate eating disorders, and we have to be really careful about talking to people who we think are going to understand and get you connected with the right support. Um, and not someone who's going to say, but this eating disorder is, serving you really well. That's someone who really doesn't understand an eating disorder. So finding the right person to share with feels really important. You can seek professional help, and that could be with an eating disorder therapist, medical providers, structured programs like Balance. But also, it could be by going to one of the free support groups online that are out there. We're going to put this in the post email, but the National Alliance for Eating Disorders and some other organizations have free support groups, which are one of the first touch points that a lot of people get for just hearing other people talk about their eating disorders and recognizing, hey, maybe this is something that I'm struggling with, and puts them on that path of getting extra help. Keeping in mind that these are some gentle first steps that you could take. These are not replacement for treatment. These are not, meant to be done in isolation without a provider present supporting you with these things. Eating consistently is obviously a huge goal. Reducing the amount of time you spend body checking or thinking about your body, and then practicing self-compassion. And that can look like a lot of different things, but each person can figure out what it feels like to actually treat themselves with kindness and compassion. And just doing small things like having your favorite coffee, drinking out of your favorite coffee mug, things like that can be really helpful. And it's really important that we note there are also some times where immediate help, medical help is needed. If there's any feelings of fainting, dizziness, frequent vomiting, severe restriction, rapid weight changes, self-harm, or suicidal thoughts, these are some of the moments where I would say immediate support is definitely needed.
Okay, so how do you approach someone that you care about? So the principles here are shaming doesn't work. We want to choose a calm, private moment. So not at a party, not at the dinner table in front of everyone. Privacy, I think, is very respectful. And then speak from a place of concern, but non-judgment, not blaming. I think when we blame and judge, often when we go to that place, it's because we're scared. So really checking in with yourself and trying to come across with the empathy and care and kindness that is really in your heart. And then focus on behaviors that you've noticed as opposed to making a lot of accusations. And I would really highlight this last point to avoid comments about weight or appearance. So speaking about behaviors, but not about weight, nor appearance, because that gets into a whole other place. What not to say? Just eat normally, as if, because I'm sure that if the client could or your friend could, they would. You don't look sick. That's certainly not going to help. If someone comes to you and says, listen, I'm really struggling, and you respond with, well, you don't look sick, that's pretty invalidating and further, I think, reinforces this idea of not sick enough. You're overreacting. Also, that would drive someone to reconsider reaching out for help. So those are three key pieces to not speak about, including the weight. So suggestions for a supportive script might go something like this. I've noticed you seem really stressed lately, and I care about you. I'm here for you if you want to talk. I love that because you're saying, I'm here for you, but you're also not forcing this person that you care about to sit down and lay out all of their concerns, because they may be feeling a lot of shame. They may be still caught up in the secrecy of it and are not ready to talk about it, but you're definitely letting them know. And I will say this, and I'm sure you've heard the same, Lily. So many of our clients have said, I had a friend when this all started. I did have a dear friend who came to me, or a family member who came to me and said, I've noticed some things. I'm here if and when you're ready. I'm here for you. And even though that person may have taken a little bit longer to finally get to a place to reach out for help, it was something that stayed with them that others were noticing, and that they could go to that safe person for help when they were ready. We'll go to our next slide.
Yeah, I think that's something I hear all the time, and I'll speak from my own experience. That was my experience of getting treatment was a really dear friend sitting down. I remember sitting in the coffee shop. She shared with me what she noticed in like such a safe and loving way. And I always thank her. And she's actually a registered dietitian too. And we've been able to collaborate on some care. So it's been really lovely to see that kind of full circle moment. I wanted to add to the what not to say. Since a lot of you are here saying that you notice you have friends who might be struggling or someone else who's struggling, I think it's really important to note that any time that we bring up negativity towards food we're eating, our bodies, people are listening. So just being a little bit more conscious of when you do say something like, oh, I haven't eaten since, the morning, or I was so bad, I ate this. I think usually why people speak like that is because they want to feel connected to each other. And we think that diet culture is this way that we can all come together and agree on something and say, oh, yeah, we all hate our bodies and we all want to change our bodies. I want to challenge you to think of what are some other ways that you could try to connect to the people in your life that don't involve shaming food or shaming your body, because I really bet that you will feel more connected to people if you don't use that negativity as the starting point. So on this slide, we're showing where and how to get help. So when to reach out, we've kind of gone over what signs to look for. Like if your eating or body concerns are causing any distress, your daily life is affected, your physical symptoms are appearing, like those medical symptoms we talked about, something just feels off, even if you can't explain it. What can professional help look like? So, outpatient therapy can be a great first step. As an outpatient therapist, I'm always constantly assessing if my clients do need a higher level of care. And oftentimes, outpatient therapy can be that first step to get you to a place like Balance, where they'll do a more comprehensive intake and help figure out what is the right level of care. You also can just go directly to intensive outpatients and partial hospitalization programs like Balance, where you can set up your own intake appointment and get a sense of if that is a right fit for you. They do comprehensive evaluations all day, every day, and they're really the experts at that. So I like that as a first step because it's going to give you really important advice and care around what step to take next. Residential treatments are also another option. So, although Balance doesn't offer residential treatment, they partner with a bunch of different residential treatments, in the area, locally, in the city, and also like all over the United States. There's tons of treatment centers as well. And then finding support, there's some really great lists of eating disorder informed therapists, which we can share in the post webinar email. There's the structured treatment programs like Balance. There's some really great doctors who work with eating disorders, at least in New York City. I can't speak for outside of New York City, but I believe there's some lists out there on some of the organizations' websites, like the National Alliance for Eating Disorders. And then there are some crisis services if safety is at risk. And that could look like going to the emergency room as well as utilizing some of these other organizations. Needing support is not a failure, it's a step towards healing. And I would actually say that you deserve support. So instead of needing support, it's like deserving support is how I would phrase it. We can go to the next slide. Yeah. Oh, made it to our Q&A. We actually have time. So if anybody has any questions, please put them in the chat. I know this was kind of a brief overview. There's so much more we could say. And I know me and Mulaney could talk about this all day, but we want to make sure we're answering any questions you might have. So feel free to drop some questions in the chat.
So a couple have come up here actually already, Lily, if I may.
Yeah.
So one of the first ones is what is the difference between anorexia nervosa and bulimia? How would you describe that?
Yeah. You want to tackle that, Mulaney?
Oh, sure. So anorexia nervosa is thought of as a restrictive disorder, which it is. People with anorexia usually lose a significant amount of weight in a short period of time. And it has been historically thought that that person ends up in a very, very low weight, which historically that was the definition of anorexia. We now know, however, that people who are in higher weight bodies can also develop anorexia. The end point of their weight loss, however, may be what the medical industry considers a normal weight, or even still a higher weight. But there was significant weight loss in a short period of time. So really, that is the definition of anorexia, no matter the body shape that that person is in. Our concern right now with GLP-1s is that we're seeing people who are going through what we consider a medically induced type of anorexia. So that's something that's very concerning. Bulimia also has a lot of restriction involved. However, with bulimia, clients will then eat a meal, but they'll end up overeating at that meal, and they'll feel great distress, so much so that they feel a need to get rid of that food. And so then they may self-induce vomiting or use laxatives or other types of medications to get rid of that food. So with bulimia, we don't necessarily see significant weight loss over time. We can often see weight shifts up and down with bulimia. Bulimia is actually very similar to binge eating disorder. The overeating component, often alone, and in a short period of time causing distress, is the same as binge eating disorder. With binge eating disorder, however, the clients don't usually have a compensation for it. Often our clients will talk about going into a food coma or falling asleep and kind of going into a zoned out place. So that's a little bit about how anorexia, bulimia, and binge eating disorder are similar, but also have some key differences.
I would just add to that also that there's also exercise bulimia, which is mostly focused on also still some restriction, but using exercise mostly as the compensation. I think that's an important piece too. And then also atypical anorexia, which is anything but atypical. I hate that term, but that is when we see people restricting with the same amount of like vigor as someone with anorexia nervosa, but their BMI does not reach that same low point that someone in a smaller body might. So this looks like someone who is still very medically at risk because of their severe restriction, but they don't meet that BMI requirement. And again, these are the people who I see getting the least amount of support and really getting missed in eating disorder treatment is people who are residing in larger bodies and still have either significant weight loss or no weight changes, but are engaging in intense restriction. So that's something to note too. That's a really important diagnosis as well.
Yes, absolutely. And in fact, there is a question here about exercise bulimia, but you covered that beautifully. Here's one, Lily, as a therapist. How do anxiety, depression, OCD, and trauma relate to eating disorders?
Yeah, I think I sort of touched on this lightly in the presentation that eating disorders to me can usually be Mulaney said this really well that there is this genetic predisposition that we've learned a lot more about in the past few years. But I think eating disorders can also be looked at through the behavioral lens as tools to manage distressing emotions. A lot of people, I look at eating disorders almost like if you have a bottle and you put like a stopper on the bottle, and let's say your emotions are in the bottle, the eating disorder can kind of put a stopper on your emotions so you don't have to face those big emotions. They can kind of develop as this defense mechanism against emotions. And that could really be related to having intense amounts of anxiety. One of your coping strategies might be turning to food or controlling your food or controlling your body or feeling that in order to deal with the distress you have, you need to control something else. I think also depression can be really interestingly linked to an inability to take care of yourself. And when I think about nourishment and feeding yourself, there is a big component of valuing yourself and feeling like you deserve that nourishment and support. So I think tangibly, in some ways, depression and anxiety can actually make eating really difficult for a lot of different people. And also, I would say anxiety and depression also um, turn you away from your internal signs that are happening, right? When you're in this fight or flight with anxiety, you can't be tuned into that part of you that would show you when you're hungry and when you're full. It kind of turns off all the other functions in your body, and the cortisol rises, and you're not able to figure out, am I hungry? Am I full? You're only able to deal with the anxiety in the moment. So I kind of went all over the place, but that's some of the ways that I see those being connected. Um, I see there's also a question about GLP-1s and asking about the relationship to the gut hormone that creates satiety. I don't know if you want to tackle that, Melanie.
Yeah, absolutely. So, GLP-1 is actually a naturally occurring hormone that we produce in our gut when we eat. And what it does is it just naturally slows down digestion so that the body has a chance to break down our food and absorb it without creating a big spike in our glucose. And so the GLP-1 medications are that exact same hormone that's been tweaked. So you only need to inject it once a week. And it was originally designed for people with diabetes. And now we're seeing that one of the side effects is also weight loss because as it slows down all the passage of food in your system, it makes you feel fuller for longer. So people therefore eat less food over time and we see weight loss. It also has a secondary impact, which makes it quite different to any other weight loss medication, and that is that it crosses the blood-brain barrier, which is quite rare. The blood-brain barrier is like a sieve, if you will, that protects the brain from any kind of toxins or large molecules. And because this is 97% natural hormone, it's able to cross into the brain and it hits the reward system in the brain. So people describe that they have less preference for high sugar foods and high fat foods as an example. So we're seeing a double action then with GLP-1s. One is slowing down your GI so that you feel fuller for longer. And number two, changing some of the food preferences. And that's why, because of perhaps those two actions, that people are seeing the kind of weight loss that they're seeing. I will say this with GLP-1s, they were designed for people to stay on for a lifetime. They're not designed for people to go on and off, because if you do come off them, you do regain the weight plus some, and in fact can negatively impact your body composition because you tend to lose muscle mass when you lose weight with those medications, as with any kind of fairly restrictive eating, restrictive kind of diet plan or medication. Okay, another question here was how do eating disorders show up in BIPOC communities? Lily, would you like to take on that one?
Yeah, eating disorders show up in all walks of life. So they show up in every identity across every age group, across every gender, LGBTQ, every identity, I feel like this question is more like, how does it impact everyone? And it does impact everyone. This example could be triggering or sad. So I'm sorry if this affects people negatively, but I kind of think of it like cancer. Cancer doesn't care who you are, what you're going through, what's going on with, your identity or where you came from. These impact everyone. So everyone is impacted by these eating disorders and these dysfunctional relationships with food and body. And we only have 2 minutes left, so we're going to go to our last two slides and we will answer more questions. Feel free to email us and continue this conversation. I know my inbox is always open for that.
Great. Thanks, Lily. So wonderful conversation today. A little bit about balance. I mentioned our programming, our PHP, our IOP. We treat all genders, 15 years and above, the full spectrum of eating disorders. And as I mentioned, we're in network with United Healthcare, Aetna, Cigna, Oscar. And we have a 14-day spring and summer intensive programs. We find that our college students really enjoy those in between sessions. And if you are interested or would like to reach out for more information, you can contact us here at Balance at outreach@balancetx.com, or you can give Lisa a call on 917-453-2450. Over to you, Lily, and your last slide.
Yeah, so as I said, I have a group private practice. This is some of the clinicians on my team. My email is here. You can also follow along on Instagram. I try to share some helpful tips on there. And my website, we work with individuals, couples, and families in person in Manhattan and virtually in New York, Massachusetts, New Jersey, and Connecticut. We see all genders, all identities, and we work with clients 12 and up. I do host a monthly dinner. So if anyone on this call is in New York City and interested in joining my recovery supper club, we'd love to have you. This is a dinner that is for people who have a history of eating disorders, but also can be for anyone who wants to be in a non-diet, non-judgment space and practice eating new foods and being with community and having fun and laughing. This isn't about sharing our war stories, but it's more about just having a fun time with people who really get it. So if you want to join that, you can visit my website and sign up for a free call with me to talk about if it would be a good fit for you. And thank you to Zencare and Mulaney, my co-presenter.
Thank you, Lily, and thank you all for joining us today. It was a pleasure.
Thank you, everyone.